again to another edition of IRD Physical and Hand Therapies Health Talk. A belated Happy New Year to you, along with Shannon O'Kelley, Tom Huntler. And we're going to have a conversation with Dr. Cynthia Warner, whom we've heard from before, Shannon, talking about signs and symptoms of atrial fibrillation. Very important to know those signs.
Dr. Warner, welcome again to Health Talk. Thanks for joining us. Again, we're doing a cardiac series. Last week we talked about symptoms that you should not ignore and get in and see a cardiologist or someone to check those symptoms. Particularly right now, it's safe with COVID. The physicians and the clinics are taking extra precautions to make everybody safe. So as part of our series, we want to talk today about atrial fibrillation. We hear about it. We see some medication on the TV. But I think our listeners need to know, what is it? What are the signs, symptoms? Give us the rundown on AFib.
Sure. So atrial fibrillation, also alluded to as AFib, like you just mentioned, is the most common heart arrhythmia. Normally, the heart beats in a coordinated fashion, where the top chambers of your heart, the atrium, beat in a coordinated fashion with the bottom chambers of your heart, the ventricles. And what happens in AFib is the top chambers, the atrium, no longer coordinate with the bottom chambers. So the top chambers, they just sit there and quiver or fibrillate. And the bottom chambers see that, and they try to match that fast quivering pace. So atrial fibrillation will have a tendency for the heart rate to go super fast, 160 beats a minute or even faster. The second part about AFib that's important, aside from the rapid heart rate, is since those top chambers aren't giving a nice concerted contraction, then the blood flow through them is slower, which increases your risk of forming blood clots, which then increases your annual risk of stroke up to 5 times. So that's, in a nutshell, what atrial fibrillation is.
What are the causes? I mean, who gets it? Who's predisposed to it?
So in terms of who's at risk, it really kind of runs the gamut. There are some people that have no obvious cause or precipitant for AFib. But in general, your risk of AFib increases with age. It increases if you have cardiovascular disease, diabetes, kidney disease, underlying lung disease, or untreated sleep apnea, or if you're a moderate to heavy user of alcohol and caffeine. In terms of symptoms, it can be quite variable. Some people on one end of the spectrum, they feel absolutely nothing. They really don't feel any different. People on the other end of the spectrum, they can tell you the moment their heartbeat goes irregular and fast. They just feel the irregularity of it. And then most people are kind of in the middle. They can feel super fast heart rate. They can feel the palpitations of that fast heart rate. They can feel significant chest pain or discomfort, or major shortness of breath, lightheadedness, or excessive fatigue in absence of any reason to have that.
How long do these symptoms last, or how long can that AFib last? And then how do you detect it and treat it as we wrap up here?
AFib, in terms of its duration and its frequency, again, can be very variable. For most people, they can have episodes where they have atrial fibrillation. It comes on, they might experience a fast heart rate, and then it goes away. But there are some people where they go into atrial fibrillation with a fast heart rate and it stays. Usually, if it's staying around and your heart rate is beating fast, then that's usually going to precipitate those symptoms that we spoke about. If you're feeling those symptoms, especially the super fast heart rate, you check your pulse. If you're seeing excessively fast heart rates, then usually you're going to experience some of those adverse side effects with it. And if you are, and especially if it is a new diagnosis and something that's new for you, then just go on in and get checked out.
Dr. Warner, again, thank you so much for that information. I love doing these cardiac series. Most importantly, if you're out there and you have symptoms, get these things checked, because it's important to get in, and it's safe to go to the physician in today's COVID world. Thank you.